Outside of the hospital setting, do you think physicians, nurses, and other healthcare workers who are seeing patients should be wearing masks?
Yes, definitely. I mean, they should be taking all precautions because, as you know, this is a pretty highly infectious virus and it can be easily transmitted. So, all precautions should be taken.
And since the start of COVID-19, do you think medical institutions are doing a better job now of protecting their healthcare workers, or do you think that more needs to be done?
So, I think we have a better understanding of the measures that we need to take in a variety of settings. And in the beginning, there was also a shortage of personal protective equipment. And I think that is definitely better, uh, better now. But I think we still need more education for the public because there are some continues to be mixed messaging, about this precautionary measures and what we need to do, whether mask should be worn or not. And I think there's much more education needed for the public and a very consistent message to help in preventing the spread of this virus.
And speaking of masks, in the US, we're seeing an uptick in the number of COVID-19 cases. What is your take on the importance of face masks being worn in public?
I think it's absolutely important for people to wear face masks. In fact, if you look at the spread of this virus, countries that adopted widespread use of face masks were able to much more effectively control the spread of this virus than we've been able to control. So I think that even at this stage, we should make it um, necessary to wear masks in public.
And just lastly, are there any other important takeaways regarding your research?
So all I would say is that we need to take precautions, like hand washing, social distancing, try not to touch your face, proper cough and sneezing etiquette, avoid shaking hands, stay at home if possible, avoid crowds, and wear a mask when in public. I think these are just common sense precautions that will help in curtailing the spread of the infection.
Very good, Doctor. Thank you for taking the time today to discuss this important issue.
You're welcome, and thank you for inviting me.